A grassroots organization of health professionals called Defend Public Health has released a new report on the root causes of illness in the United States. Welcome to Care Talk Live, where we talk about how healthcare works or doesn't work in America and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your health insurance and healthcare questions at 202 838 6837, and our experts will answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's Care Talk show. In today's episode, healthcare expert Elizabeth Jacobs talks about how to get beyond false, flawed, and fundamentally incorrect interpretations of science, medicine, and disease outcomes to improve our health with evidence-based public health policies. So welcome, Elizabeth Jacobs, an epidemiologist and professor emerita at the University of Arizona and a founding member of the advocacy group Defend Public Health.
Thank you so much for having me, Laura. It is genuinely an honor to be here with you today. I'm a big fan of your work.
Thank you. And I'm a big fan of you too. So let's start with this new report that you just released about the root causes of why so many of us are or get sick in America. So what are the root causes?
So there's a lot of root causes, and they really go back to the fundamental issues of things that impact our health every day. It's well beyond our individual experience and really has a lot to do with where we live and what resources we have and things like that. So the foods we eat are very important, for example. But one of the biggest challenges we face in this country is, in fact, that there are 13 million children who do not know where their next meal is coming from, for example. And for example, with physical activity, it's one thing to suggest that people should go out and get exercise. I'm sure we all agree that exercise is probably the best known protective factor against many, many diseases. But it really isn't that simple. If you can imagine a single mother, perhaps, who works two jobs or even one job, and then is expected to get some physical activity after an exhausting day, it is really hard to do that. And then, of course, there are costs involved with physical activity. Can you afford the proper clothing or equipment or things like this? So what we are doing with Defend Public Health is really looking deeply at some of the things that underlie the challenges with, for example, something that seems as simple as just getting exercise.
Exactly. So your report goes into some of the issues with access to healthcare. And you mentioned food safety and physical exercise and just being able to see a doctor. Some people live in places where medical support is far away. You mentioned that some things we have control over, like we have some control over how much exercise we can get or what we eat. But some of these are societal issues. Like we as a country need to ensure that our water is safe to drink, our air is safe to breathe, that the food we eat is safe to eat. So let's talk about what things need to be done as a society for public health, for everyone to be able to live healthier.
Well, you've certainly listed a number of really important ones, and I think access to healthcare is a huge one. Unfortunately, right now, we're actually seeing access to healthcare be reduced in the current administration. And when we cut things like Medicaid, it's really important that people know that it's not only people who are on Medicaid who will experience potential harm, although that is bad enough. It's also individuals, say, in rural areas where there is maybe a small health clinic that relies on Medicaid payment and now it is going to close. So that is a serious issue that is related to cutting Medicaid funding. Another area would be cutting SNAP funding. That's of serious concern as well. And we can go as far as to say that vaccination actually is another major one. I wouldn't say as far as to say. In reality, reducing access to vaccines is a very serious challenge that we are facing right now. And I just would really implore people to look at their state requirements for vaccines and sort of, if they can, get active in trying to support and backstop some of those requirements for school entry vaccinations. And we can probably talk about that in a lot more detail if you want, but that is another issue we are really focused on, as well as gun violence and reducing gun violence. The gun violence is actually right now the #1 cause of death of children in the United States. And I think that's pretty shocking. So these are things that we are really considering in Defend Public Health and with our report.
Okay. And so there are things that any administration could and Congress could choose to do to make for a healthier America. And unfortunately, many of the things in your report are not happening. Can you
Right.
talk about some of the things that this administration or any administration could choose to do to make our lives healthier?
Sure. And I do think, again, access to vaccines is critical. And I think that right now, particularly with COVID vaccination, it may not be popular, but whether it's popular or not is completely immaterial to me as a scientist. COVID vaccines reduce hospitalization rates, they reduce the risk of death. It's really important to actually promote that type of work, and to really promote vaccination overall. Another thing we're seeing is declining vaccination rates among children, and any competent administration would actually promote vaccination as a primary way to prevent both immediate infectious disease, but also long-term outcomes that can come from getting a vaccine preventable disease. And so many diseases that we can now keep kids from getting just with a vaccine are going to crop up again, and it can be a really long-term challenge for people. One of the things that comes to mind immediately would be polio. We know really well what the impact of polio epidemics were before we had a vaccine for it. And so there were, of course, was the risk of death, but there was also the risk of long-term disability among people who suffered from polio. And if we think about right now where we are in this country, a lot of even young healthcare professionals have never seen a case of polio. Many Americans have never seen a case of polio. And so the absence of this is due to vaccines. They're a victim of their own success, because that means that people are no longer really aware of the dangers with vaccine preventable diseases. And of course, we have seen that already this year with measles, where 2 children have died from the disease. And again, it is preventable with the vaccination. So what should the government be doing? Endless rollouts of vaccine information, vaccine program funding, and that would be at the local and the national level to really encourage people to get vaccines.
Hmm. And also talking about vaccine preventable illnesses, I think it's important to think about all of the diseases that vaccines could be used to treat and cure in the future if we keep funding vaccine research, which unfortunately is on the chopping block. It's my understanding that they're getting pretty far in discovering vaccines that will prevent specific types of cancer. But cutting off that research means countless people will suffer and die because of the research we didn't fund.
Absolutely. It has been called the greatest tragedy to public health right now is ending that funding for mRNA vaccine research. And yes, it sort of got this bad reputation because of the public pushback against COVID vaccination. And unfortunately, that's going to have an impact on all these other applications for mRNA vaccines, including they were pretty far ahead in a vaccine that could help treat pancreatic cancer, which unfortunately people who have experience with know that that is a very difficult disease to cure. It is among the deadliest of all cancers. And then there's other conditions like multiple sclerosis, which is caused by the Epstein-Barr virus. And that's another area where perhaps a vaccine could wipe MS off the face of the earth. And we are going to lose that with these funding cuts. So it really is a tragedy. And it's also an inexplicable tragedy, because the popularity of something should not dictate whether it is pursued or whether it is public health policy. And we see examples of that with seatbelts, that people were outraged that they were being asked to use seatbelts, or the major pushback against smoking, for example, in public places like restaurants and bars. And a lot of people said, well, these bars are going to go out of business. But what actually happened is business increased in many cases, because people who don't smoke were actually able to go out and enjoy a meal or a drink at a bar once these regulations went into effect. So I think that the idea that Director Bhattacharya gave about how the public hasn't accepted mRNA vaccines and therefore we're no longer going to study them is fundamentally flawed, and in fact fairly egregious in terms of scientific research and public health policy.
So let's go back to that statement that people haven't accepted mRNA vaccines, and so we should stop studying this groundbreaking technology that could cure some types of cancer. Can you explain for the audience what an mRNA vaccine is? So maybe people have some misconceptions that you can clear up so that people understand what it is and isn't.
So without getting too into the weeds technologically, it simply uses messenger RNA, which is already present in our bodies, to deliver something that your immune system will recognize. And this is how your immune system works. It sees something and it's sort of trained up to recognize it. And so the next time it encounters whatever that is, it's going to attack it. It will recognize it as a foreign body and it will attack it. And so there's really nothing particularly alarming or scary about mRNA. In fact, again, we have it in our bodies already. So I don't fully understand why there is so much pushback against it. Its greatest utility in terms of why it is so important is that it is a very flexible way to make vaccines. And we could see that with the COVID vaccines that came out so quickly. And that was astonishing. In fact, some people did ask me in March 2020 if we would have vaccines by the end of the year, and my answer was no way. And we did. So that is the power of that platform.
Mm-hmm. So an mRNA vaccine just gives your body a blueprint to attack the things that it should be attacking, whether it's COVID virus or cancer cells, right? It's just directing your own body's immune system to attack the bad stuff.
Right, exactly. So, and you know, there some people will say that there hasn't been a lot of research on it, for example, but by now, hundreds of millions of people have been vaccinated with COVID vaccines all throughout the world. And I will, say up front, there were some side effects, including myocarditis among young men in particular. But I really want to emphasize that that was a very rare adverse event. And furthermore, the risk of myocarditis, if you were infected with COVID-19 anyway, is far greater than it is for the vaccine. The other piece is that those cases really resolved quite quickly and there's no lasting harm. So it does sound frightening when people will say, well, it caused these cardiovascular issues and things like that. And I am not dismissing that at all. But after 4 full years of study and publications, we are just not seeing a signal that indicates in any way that these vaccines are harmful to humans.
Hmm. And you're right in that you point out that vaccines, especially given to a large population, some people, even if rarely, will have side effects. But I think it's so important to remember that the side effects of the disease are so much worse. And as a cancer survivor, I went through 6 months of chemotherapy and a month of radiation treatments. And I will likely have heart and lung side effects. If I could have taken a vaccine to not get my type of cancer, I would have done that in a minute because that would have saved hundreds of thousands of dollars, months and months of agony, and nearly dying. And I'm the fortunate one to be in remission. So I think, measles can hurt, can kill. All of these vaccine preventable diseases are not good. You don't want them. And a vaccine is so much easier.
If I could just add to that, I don't know if you know this, but I too am a cancer survivor, but my cancer was caused by HPV. And so this is very germane to this conversation because now there is a vaccine for HPV. I'm 54 years old, so there was not one in the window that I would have needed it. But per your comment, I would have much preferred to have a vaccine than to go through what I actually experienced. And so the thought of those vaccines not being available to young men and women in the United States is absolutely devastating to me.
Hmm. And my form of cancer, Hodgkin's lymphoma, they're not sure. It may be Epstein-Barr virus may be a contributing factor. And again, that's something they're working on a vaccine for. And it makes me so frustrated to think that I could have avoided the worst year of my life and nearly dying if that research had been there, and that some future Laura is going to go through what I went through because we stopped funding that research.
Yeah, it is devastating, and I think the idea of prevention is sometimes really hard to get across because you can't see it. You can see a treatment, you can see that somebody recovered, but it's really hard to prove to people's satisfaction that you've prevented something because by definition it didn't happen. And so getting these ideas across to your audience, I think, is really, really important. And I've worked in prevention my entire career, and I'm very familiar with these challenges. And so I especially appreciate you speaking out about, an alternative universe that could be real. It could exist if we just keep pursuing these areas of study.
Hmm. Exactly. That's why funding of public health research is so important. And going back to the causes of the root causes of illness in America, I was struck by how many things in your report are things that you don't see the effects of right away. If people in your community are not vaccinated, some people will get sick right away, but it's really over time that the entire population becomes vulnerable. And same thing with clean air and clean water and nutrition, making sure that our food supply is safe to eat, that getting rid of the watchdogs and the rules on all these things. You may have some bad lettuce or bad deli meat. You may feel the effects right away, but it's really over time that everyone's will be sicker. Our lives will be worse because we stopped working on the things that actually prevent illness.
Exactly right. And I want to point out again how difficult it is to explain, to really not explain, but to really take on board the effect of prevention. Because I'm going to use an example from 1948. There's a city outside of Pittsburgh called Donora, Pennsylvania, and there was so much pollution there from the steel mills and the wire works that were there that one day in October, the pollution got so bad that 20 people died. There was a temperature inversion, and it just trapped all of the pollution in that city. And that actually did initiate, uh, at least start a response to air pollution, but it was just because it was so visible. On the other hand, I went and revisited those data, and I could see that years after that event, people were still had higher cancer rates. So that's the longer term piece that you can't see these effects of being chronically exposed to polluted air, polluted water, and things like that. So yes, it may take time for some of these things to become really clear, but I really would prefer not to go back to a day when 20 people died because of air pollution in the United States.
Right, or back to the day where the Cuyahoga River was on fire because
Yes.
we're trying to move forward to a healthier air and water and food instead of going backwards. Where the reason why these agencies were created in the first place is that you cannot rely on the benevolence of profit-driven manufacturers that before the FDA actually regulated all these things, before food supply was regulated, they would routinely sell food that was not safe to eat, that had been doctored with all kinds of things to look good, to get it out the door, but that were dangerous. And it is frightening that in some ways we're going back to that.
Yes, and for those who have had the very good fortune to travel outside the United States to other countries, you can really be met with this massive culture shock of what it is like when there are not these controls in place, what the air quality is like, and it's very, very notable. So again, I think it may be difficult for people to even imagine how bad the city of Pittsburgh was in the 20s, 30s, 40s, etc. But if you go and Google some pictures of Pittsburgh in that era, you can get a pretty good idea. But yeah, these regulations, it's not for fun. It's not to purposely cause just more paperwork or something like that. It is so that we and our children and our children's children can breathe clean air, can drink clean water. And it is definitely a worthy pursuit.
So let's talk about the first Make America Healthy report that was released. So this report from Defend Public Health is released now to talk about the root causes of illness, because there is a second MAHA report coming soon. And you all wanted to put out some of the things that are probably not going to be covered in that report, but that are key to whether we're sick or well. So in that first report, what are the things that were missing that you really wanted to cover to make sure people were thinking about these things?
Sure. Well, the first thing I want to mention is that we actually have contest the very title of the report, Make America Healthy Again. Our argument is that America has never been healthy for everybody. And let me give you an example why. Mr. Kennedy likes to refer back to when his uncle was president in the early 60s. And to illustrate that, he highlights the rates of obesity during that period. But what he is ignoring are some absolutely horrible scenarios that existed at the same time. One of those is that the infant mortality rate was 4 times higher in the early 1960s. Another one would be that 42% of adults in the United States smoked at that time. Now that number is around 11%. And in addition, since the 1960s, the average lifespan of an American has increased by 7 years. So Our argument is that America was never healthy. And so when we were writing our report, we were trying to reimagine what it would look like to really try to work together to improve the health of every American, no matter their resources, location, anything. And so, there were a great number of things that are missing in the original MAHA report. And one thing I want to point out, since we have talked about a few of them, is the massive impact of scientific misinformation and disinformation is having on Americans right now. There is so much false information, false claims that are circulating around the internet and social media at any given time. And it is really difficult to sort of pick out what is a reliable source, what is not, and then to be influenced by that. It's really a problem because there have been studies that show that conspiratorial type of health information will circulate around social media 22 times faster than just a boring scientist saying, hey, vaccines actually don't cause autism. In fact, they prevent disease. So this is a very serious problem, and it's almost intractable right now because social media companies don't really have that much of a motivation to sort of regulate this type of misinformation, because it generates engagement with their platform and therefore they make money. And so we've got to go back to starting at kindergarten to teach kids to really think critically about what they're reading, consider the source, and just test it out in their minds. Who's telling me this? Is it true? And just sort of treat everything with skepticism. And I don't mean denial of facts by that. I mean actual skepticism, before you devour bites of information without really thinking about where they might be coming from or what the motivation might be for those appearing in your social media feed in the first place.
And speaking of accurate medical and scientific information, how can people find you and Defend Public Health on all the social media platforms to get that accurate science-based information?
Thank you for asking that. We have our website, which is www.defendpublichealth.org. I am on Blue Sky as Elizabeth Jacobs, and I'm also on Threads as one Elizabeth Jacobs. Defend Public Health has a Blue Sky account, and so those are the best ways to follow us on social media and the internet.
Thanks. And in general, I think Blue Sky is a better place to find accurate scientific information than the site formerly known as Twitter, which has a lot of medical disinformation on it.
It sure does. Yes. It's a big problem. And, I left Twitter a couple years ago and I went back recently, and I was actually stunned by how bad it has become with regard to misinformation. It's absolutely shocking. So, yeah. Blue Sky or Threads, much better choice.
Well, thank you for joining us and for delivering the facts. And we will have a link to that report from Defend Public Health on the various social media platforms. And thank you, everyone, for joining us today to learn how to protect our health against dangerous attacks on research and medical and wellness disinformation. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.